Good afternoon, everybody. Welcome to our COVID-19 update. I know it's been a while, but we're here to share some information with you. As usual, I will give you some numbers here from the New Pasco area. As of August 7th through August 13th, we had 51 cases, and that's up 5 cases from last week. I'd also like to report that there are no new deaths. We still stand at 54. And I'd like to say that 60% of New Pasco residents and community members have been vaccinated. So we think that's a really good thing, and we're proud of everybody for coming out. So please continue to come out. And we'd love to see more people get boosted. We're only at 20% at the boosted level. So please come on out and get your booster or get your first vaccine. And then for the Guadalupe area, this report is August 10th, 2022. Their cumulative cases for all the organizations up in the valley, Pasco Yaqui Tribal Health Services, Maricopa County, the state, and others, is 3,759 cases, 44 deaths, no new deaths up there either. So those are the numbers from our 2 communities. And so Dr. Renteria is also going to share some information with you as well. Thank you.
Buenas tardes. Good afternoon. I'm going to just talk about basically 3 things, okay? One is that there's been a lot of information all over the place on monkeypox. So basically what I want to let folks know in our tribal community is that, at least at this time, don't panic. There are very few cases, and it's a condition that requires very, very close contact, physical contact with someone who would have the virus, and the people who would have it would have a rash with little blisters or vesicles that you can actually see and are hard to mistake for anything else. So it's easy identifiable if you look. The problem is there's not a lot of the vaccine, and right now it's being controlled by Pima County. We don't have it. The tribe, we don't have the vaccine. We don't have what's needed to diagnose it. So it's all being controlled by Pima County. If you think you were exposed to someone, then contact Pima County. You can look it up at their website. They have phone numbers. For those of you that are in the health industry and you're extremely high risk nurse or doctor that's working with the populations at risk, they will consider vaccinating you prophylactically, but that's not even a sure thing. So the important thing is there aren't tons of cases. Pima County has reported that is probable 22 cases. They're still in the process of being confirmed, and Maricopa County is 183. So in the metropolitan area of Pima County, Tucson, we have about 1.2, 1.3 million people. We're talking about 22 cases here. In Maricopa, I'm guessing Phoenix is close to 3 million by now, and
If not more, yeah.
If not more, and that's 183. So I think people are just afraid, but just use common sense. Don't have contact with someone that has a rash that you don't know what it is, and just be careful. So if you really want more information on that, you can send me an email to the tribe, the medical director's office. You can get a hold of me through the contact information at our website. The second thing I want to talk about is the health department, and with the blessing of the council. This is for tribal employees, government, and casino. We are creating a new commercial plan that we are managing. So if you're a tribal employee, you are eligible, and if you have dependents, even if they're not tribal, as long as they're your dependents, they are still eligible. Basically, we have an entity called HealthSmart we're working with, but the actual health insurance coverage is Blue Cross Blue Shield of Southern Arizona. If you want more information, contact Rosa Rivera or Yolanda Varela, said you have a health plan. But this is a commercial plan that I think is very important because it's very good coverage. And my understanding is that if you're an enrolled tribal member, there's also no premium for you, so that saves you money. So the enrollment period is now, and I believe you have to enroll before the end of the month. So that is for tribal, government, and casino employees. The last thing is just COVID-19. Just wanted to let folks know now, if you've been reading anything in the paper or online from the CDC, They basically are just saying, look, it's up to local jurisdictions, but the bottom line, their main recommendation really is this, is that you wear a mask if you're a high-risk person. So as we talked before, high-risk people are those that have cancer or certain serious chronic infectious diseases where they take meds all the time, or people that have rheumatoid arthritis is severe, anybody taking steroids, that kind of thing. They're just saying, look, those folks, you should wear a mask. For those that aren't that, you can still get infected. Now, the disease isn't causing a lot of symptoms, but the question is, no one knows what the long-term effects are. And there is a lot more data now that even young people who are infected didn't have a severe course, a certain percentage will have heart problems, liver problems, and kidney problems, and lung problems, maybe 5-10 years from now. But there's a lot more information on that, and the government obviously looking into it. So it's not gone, it's here. You can still get infected. I think you should still be careful for at least another year or two. But the bottom line is, for those that are high risk with serious conditions, you should be wearing a mask. And as Andre Senior has mentioned, we have vaccination clinics every Thursday afternoon at the new health building. And the most important thing is for people in that category, or any category really, is come get your booster. We have plenty of it, okay?
Please do, yes.
We have Moderna and Pfizer, so you can get your booster and be more protected. Okay.
Thank you, Dr. Renteria. I just wanted to, I know this is a COVID update, but I really did want to remind everybody that we are in a flash flood watch through Monday, and the next 24 hours are going to be the most important time for you to please be aware of flooding. There's going to be stalled out vehicles in the road. If you can postpone a trip within the next 24 hours, wherever you may be going, just maybe wait it out. Take your time and stay indoors, because this storm is it's a storm from the north and a storm from the south that are both going to hit us at the same time. And we've already seen some flooding here in our community. But everybody, please be safe and be really be aware of your surroundings for the next 24 hours and stay safe. So thank you once again for tuning in with us. We appreciate it. Bye-bye now. Thank you.